Hi, my name is Jesus Vasquez, and this time I'm going to talk about how drugs causes a bad impact in young adults or in young people and the society itself. To start, what are drugs? Drug is any substance, with the exception of food and water, which, when taken into the body, alters the body's function either physically and or psychologically. Drugs may be legal, an example, alcohol, caffeine, and tobacco, or illegal, like cannabis, ecstasies, cocaine, and heroin. Psychoactive drugs affect the central nervous system and alter a person's mood, thinking, and behavior. Psychoactive drugs may be divided into four categories: depressants, stimulants, hallucinogens, and other. Now, short and long term effect on the body and mind. The effect of drugs will vary from person to person depending on the person's characteristic such as physical size, gender, mood, diet, age, expectations, and health. The drug itself, such as the amount used and its purity, and how it is taken, and the environment a person is in when using the drug. Some people become depressed, angry, aggressive, sleepy, unmotivated, paranoid, anxious, and talkative. Drug use can also lead to social and emotional problems and negative effects on relationships with family and friends. Now, drugs and young people. Young people's brain are growing and developing until they are in their mid 20s. This is especially true of the front, prefrontal cortex, which is used to make decisions. Taking drugs when young can interfere with developmental process occurring in the brain. It can also affect their decision making. They may be more likely to do risky things such as unsafe sex and dangerous driving. The earlier young people start using drugs, the greater their chance to continuing to use them and become addicted later in life. Taking drugs when you are young can contribute to the development of adult health problems, such as heart disease, high blood pressure, and sleep disorders. Some of the most commonly used drugs in young people. So the drugs that are most commonly used by young people are alcohol, tobacco, and marijuana. Recently, more young people have started vaping tobacco and marijuana. There is still a lot we do not know about the dangers of vaping. Some people have unexpectedly gotten very ill or have even died after vaping. Because of this, young people should stay away from vaping. Now, why young people take drugs? Well, there are quite a few reasons. Um, some of these reasons and why young people take drugs are to fit in. For example, a young people may do drugs because they want to be accepted by friends or peers who are doing drugs. Another reason is to feel good. When they abuse drugs, the drugs can produce a feeling of pleasure. To feel better, some young people suffer from depression, anxiety, stress-related disorders, and physical pain. They may do drugs to try to get some relief. To do better in academics or sports, some young people may take stimulants for studying or anabolic steroids to improve their athletic performance. To experiment, young people often want to try new experiences, especially ones that they think are thrilling or daring. Now, some of the signs and of drugs problems in young people are changing friends a lot, spending a lot of time alone, losing interest in favorite things, not taking care of themselves, for example, like not taking showers, not changing their clothes, or brushing their teeth, being really tired and sad, eating more or eating less than usual, being very energetic, talking fast, or saying things that don't make sense, being in a bad mood, quickly changing between feeling bad and feeling good, missing important appointments, having problems at schools, missing class, getting bad grades, and having problems in personal or family relationships, lying and stealing, memory lapses, poor concentration, lack of coordination, slurred speech, etc. These are just some of the signs and when a young person is abusing drugs. Now, can drug use be prevented in young people? Well, drug use and addiction are preventable. Prevention programs involving families, schools, communities, and the media may prevent or reduce the drug use and addiction. These programs include education and outreach to help people understand the risk of drug use. You can help prevent your children from using drugs through good communication with your children, encouragement so your children can build confidence and a strong sense of self. It also helps parents promote cooperation and reduce conflict, teaching your children problem solving skills, setting limits to teach your children self control and responsibility, provide self boundaries, and show them that you care. Supervision, which helps parents recognize developing problems, promote safety, and staying involved. Showing your children friends. Knowing your children's friends. So these are only some of the things that you can do to prevent your children to use drugs. Thank you. Have a nice evening.